Hey YouTubers, it's Michelle, and on this video I'm going to talk about my consult with the surgeon that I had yesterday, bariatric surgeon. 9 o'clock came and we were at the Norman Regional Bariatric Center here in Oklahoma, in Norman, Oklahoma. And right away, right at probably 9 o'clock, I was called back and was weighed on the digital scale, and I've lost 4 pounds since I was at my heart doctor's last week. I was 286 at his office and I'm 281 now, so I've lost 4 pounds. That's a pretty good thing. Was brought back to a room where my temperature was taken and my blood pressure was taken, and I was asked if I was interested in the bariatric surgery, and was it true from my writing that I wanted to have the gastric bypass, which I had to correct and say, no, I'd like to have the gastric sleeve since I know that you offer it. And the nurse had to actually make sure that Aetna covered it. I said they do. She looked and confirmed that, and she said, you're right, they do. So she said, wait just a little bit, Dr. Keith will be in just a minute. And so within 5 minutes he was in there, and he took the chart that was on the door that was waiting for her from her when she left, when he walked in, and he was going over some things, and he wanted to make sure that the things that I wrote down were correct. And he asked me about any of the medicine that I was taking, and I said currently right now I'm taking 4 baby aspirins and simvastatin, but I had marked on the paperwork that I had diabetes and high hypertension, and I marked that because that's in my history, but I haven't had a review in over a year on it. I know that I still have diabetes. I'm not taking any medicine for it because we haven't gone and gotten any, because Craig just got insurance, so we're trying to take care of everything in order that we have money. And the hypertension medicine, I'll have to ask my heart doctor about that, but I could have sworn that he would have thought to have written a prescription when I was at the office, because twice when I visited him that week my blood pressure was up a little bit. So I would have thought that he would have prescribed something, but all I have to do is see if he's the one that does that. I don't remember if my primary care physician was the one. I think Dr. Karam is the one that does that. I don't know. There's enough pills in my mind and memory that I don't remember a lot of that stuff. Anyway, so we go on, and he, Dr. Keith says to me, he says, well, we're talking about my heart and everything, and he says, why do you have a stent? And I went through the story about that, and he says, well, you're awfully young to have a blockage. I said, well, I'm 43. To me, that doesn't feel young. And he says, that's really young. And I was like, well, you know, he said, you were like a ticking time bomb. You were probably about ready to have a heart attack. That's what Karem said. That's why the stent is in there. He said if I didn't get that done, probably within a month, I would have had a major heart attack. So we got a stent in there to keep that from happening. That is a good thing. If it pops up in your life, go ahead and get it done. I don't think I want to have a heart attack. I think that's pretty painful, and I'm not ready for that. But anyway, he said, you're really young to be having a heart blockage. That's Dr. Keith. Really young to have heart blockage. And I was like, well, you know, 43 isn't very, it's almost middle-aged to me, so it wasn't really young. And he said, as far as bariatric surgery goes, you're one of my thinner patients. And I looked at him like he was insane. I was like, what? He said, yeah, you're thin. Not thin, but you know what I'm saying. That he said he sees people a lot larger than me on a regular basis, and I can't believe that, because when I went to the seminar, there wasn't, I mean, there were some guys that were bigger than me, but the girls weren't much larger than me, if they were anything at all. We were almost all the same size as far as I was concerned. I weighed 310 when I was 40. Okay, I've not done any exercise or anything. I just changed my diet habit to drop the weight that I've dropped. But anyway, he told me that I was thin. I kind of got tickled by that. So I'm kind of proud that I'm one of the thinner patients, but I still need the surgery regardless. I still need it. And then after that, after he did the consult with me and he talked about a date, I said, oh, I heard that it's 90 days between the time that you have a consult and the time that you get the surgery. He says, no, no, no. Okay, so now listen. If you have to asterisk this in your memory, make sure you remind yourself of this. If you're going through insurance, this is probably how it's going to work. It is not 90 days from the start when you see your consult to the time you get your surgery. It's a 90-day diet program, and the surgery can be a month, 2 months, 3 months, 5 months later, depending on what you have to have done. So he reminded me that I had to have a diet for at least 90 days, and that I was going to schedule that. The next thing that we did behind him was going to be scheduling that. And I said, okay, so what's your expectation of when I would probably get the surgery? My thought was November. That would be 90 days. But I was shooting as far as December because I was giving it a month. And he said mid-December or early January. So mark that on your calendars if you're interested in knowing if I got the surgery or not. That's probably where we sit at. There are other things that can get up and creep up in the way that can cause it to even go further behind that date. But for right now, that's the expectation. Mid-December, early January. December will be a Christmas present if I get it done. January will be a birthday present when I get it done. Because I started this when I was 40. I'm 43, so I'll be getting it right around my 44th birthday. That's pretty cool. He said he was happy to meet us. He thanked us for coming and visiting. And he said that another young lady would be in the room in just a minute. Well, she took a few minutes because she was doing something with somebody else. She eventually came in. It wasn't a very long time to wait for her either. It was really fast, this whole thing. So we were led to an office where we were going to learn more stuff, where I got this. This is a notebook they gave me. If you can see, that's Oklahoma Weight Loss Options. That's also a website that anybody can go to and go look at stuff. In here is some information that I was given. Pretty much just a breakdown of what all of these are over here. I have a calendar that I have to write on every time I do anything for this bariatric surgery. I have to write down stuff. So while I was in there, we scheduled my first initial dietary consult. That's my handwriting. On the 13th of September. And the insurance requires that you have 3 of these. Three of them. You have to have 3 of them. That's what my insurance is requiring. Each one, by the way, most insurances will not cover. Each one of mine costs $100 out of pocket. So we have to have $300 when we go to this thing to do this dietary thing. Beyond that, I have a psychological evaluation, which I have not scheduled, which will require only 1 visit, $200 out of pocket. Insurance won't cover that either. I think that you need to know that. That's one of the reasons I'm making this particular video. You need to be able to understand that there's going to be some out-of-cash funds for anything that you want to do. There's physical therapy that my insurance will co-pay. Hey, out of that, that's awesome. And a support group that I'm going to have to attend, and that is mandatory. These 4 things are mandatory. I have to do them in order for the surgery to be completed and adhere to. My nutritional things I have to do, the 3 ones that I have to go to, have to be within 3 months. So there's probably going to be one month, one another month, and another a 3rd month. I don't think they do them all 3 in 2 months. I think you have to do them 3 months. Beyond that, you could do your physical therapy, your psychological evaluation, and anything else beyond that. As long as it takes you, it's still okay. But you have to do that nutritional thing within 3 months. That's what my insurance is saying. And I have Aetna. So I just thought I'd let you know that. So Craig, of course, is having a cow, finding out about that money. He was just about ready to have a fit, but they were willing to work with us and said if we could get the $100, we could pay $100 at each visit, and the psychology visit's going to have the $200 right then and there because it's only 1 visit. So I did the consult. That's pretty cool. I have an appointment with a nutritionist next month for first one, and we're going to get the money. My time is running out right now. I just wanted to let you know what was going on with the surgeon. He's a really nice guy. I like Dr. Keith. If you're in Oklahoma or the surrounding area, you have Aetna or any of the programs that, or the insurances that he covers, can cover you with, and you need bariatric surgery, any form, lap band, gastric bypass, or the sleeve, he can do it for you. But I'm trying to tell you everything that goes on. That's it for now. I got more coming. Have a great day, YouTubers. Bye.